Welcome back. Throughout the pandemic, New York City Health and Hospitals helped lead the city towards the fight against COVID 19. Joining us to discuss their continued efforts to support New York City through the Street Health Outreach and Wellness Program is Assistant Vice President for New York City Health and Hospitals, Dr. Amanda Johnson. Doctor, thank you so much for joining us. So,
Thank you so much for having me.
Of course, yes. So I want to start out just talking about the program or the initiative in general, the Health Outreach and Wellness Initiative. Can you tell us what it is and how it actually started?
Sure thing. So the Street Health Outreach and Wellness Initiative began back in April of 2021, so a little bit over 6 months ago. And it's Health and Hospitals' foray into delivering street-based, community-based mobile medical services in its most holistic sense. So we started kind of as an extension of the work that we were doing with Test and Trace. We had already been deploying mobile testing units, moving into mobile vaccination units. And I think the question is always upon us of how we can continue to bring these services to people that are other formats of extending COVID testing, COVID vaccination weren't yet reaching. And so from there, the idea of having a more comprehensive mobile medical outfit to bring services to New Yorkers of all kinds, but particularly New Yorkers experiencing homelessness, from there the idea was born.
So I think this is a really cool addition to the public health arena, and we've been seeing a lot of it over the past year. It's a mobile unit. Why did Health and Hospitals want to utilize that?
Having a mobile unit gives us certain advantages. I think one of them is operational flexibility. So with the 6 units that we have right now, each staff with a van-based team as well as a roving team, we have the ability to assess where the need is kind of on a every 2-week basis and deploy these 6 outfits to various parts of the city depending on where we feel like we can be most effective. The other thing to recognize is that the mobile medical unit is a smaller and perhaps more approachable format. So for people who might not otherwise be able to or feel comfortable approaching traditional brick and mortar healthcare as they may have experienced before, this is an alternative, one that might be a little bit friendlier, a little bit kinder, a little bit less intimidating, especially depending on their experiences with traditional healthcare in the past.
So, with the threat of the pandemic still among us, it's understandable that these mobile units offer a variety of services. What can community members receive when visiting this mobile unit?
Yeah, so kind of born out of our work with the Test and Trace Corps, we definitely wanted to make sure that we were making access to COVID vaccination and COVID testing available. But when we think about how to make our services most accessible, especially to individuals who might not otherwise be able to access our services in some of our traditional formats, we knew that offering COVID testing alone and COVID vaccination alone wasn't going to do it. There were more things that people needed to address. They were going to come get services with us. So we wanted to include not just COVID medical services, but a broader array of medical services. So we can do blood pressure checks, we can do wound care. Really, we take our cue from the patient in terms of what is their health priority for that day. Sometimes people really just want to get information. They just want to talk to us about the COVID vaccine, but they might not be ready to get it that day. We also recognize that without behavioral health, without mental health, there really is no health. And so, especially coming out of the surges that we've been in during our fight against coronavirus, we wanted to ensure that we had behavioral health support and harm reduction services built into the fabric of our program from the very beginning. And then lastly, we understand that coming to get services with us, coming to spend time with us, takes away from the time you may have otherwise spent providing for your basic needs for that day. And so we also distribute things like hygiene kits, which include toothbrush, socks, give water, snacks, just because we recognize that to invest in their health for that day, it is a moment that they're not spending kind of providing for their other needs.
Now, I'd really like to know, and you touched on it a little bit, but I'd like to know more about your behavioral health support and harm reduction services. I thought that was really interesting that that was included. Can you elaborate why you wanted to include that in your services?
Yeah, absolutely. So part of it is that it is just second nature for us at Health and Hospitals. We're an incredibly large provider of behavioral health services in the city of New York. And so if you were to come get primary care in one of our primary care practices, you would have the ability to access behavioral health services right then and there as well. And so when we do this work in a mobile format, the same philosophy applies. I think additional things that are on our minds as we emerge from the surges that we've been through, and we are facing the Delta variant is just the increased levels of mental distress that people are experiencing due to the social isolation that we've suffered during the pandemic. And so we want to be able to respond to the myriad impacts that the pandemic has had on people's lives. I think kind of getting a little bit more granular about the types of supports that we're able to provide. We want to maintain therapeutic relationships to behavioral health care providers whenever we can. So some people are seeking new services, they're seeking a relationship for the first time, but sometimes we have a role to play of reconnecting people to behavioral health relationships that they had previously. We also have to recognize that the pandemic was very disruptive to care connections people may have already had. And so if you don't have regular access to a phone and you don't have minutes and you don't have a device at the moment, you may not have been able to participate in the telehealth revolution that kept a lot of people connected to their care teams during the pandemic. So having the mobile team in person helps us circumvent that, but now we're in a stage of trying to rebuild some of those relationships. And then to put a finer point on some of the issues that we're seeing related to increases in substance use during and following the pandemic, having a harm reduction orientation as it comes to engaging people about substance use is incredibly important. You know, we're not here to shame, to blame, but we want to recognize where people are, walk alongside them, give them what they need to stay safe, and to leave the door open and let them know that we're a trusted resource. We are here to help when they feel ready. And so that means being able to offer a spectrum of services. On the harm reduction end of things, we are able to teach people and distribute Narcan kits. This is a medication that can be used to reduce an overdose. And along with that goes the teaching that there are things that you can do to reduce your risk of an overdose, including never using alone. In every area where we go, we partner with a syringe exchange program. So we are able to connect people who are looking for clean devices to be able to use to a provider in the area, and even offer them accompaniment if they want someone to walk with them to go get those supplies. We hope to look forward to incorporating fentanyl testing strips as well, so that people can detect if there's an adulterant in the substance that they're planning to consume. And these are all things that we're able to do if someone isn't necessarily ready or seeking treatment for an opioid use disorder or another substance use disorder at that time. I think it also bears recognizing that the pandemic disrupted a lot of habits that people may have had before, and so tolerances may be lower. And so there's just a lot of education that we can do to reduce kind of a rebound of opioid overdoses and other kind of concurrent substance use related overdoses kind of in the months to come.
So I'd really like to know, as for the mobile unit, how can people engage? What do they need to bring when they go to visit?
Yeah. So the mobile units don't require appointments. They're walk up, come see us. Because we're in one particular location, usually day after day for at least 2 weeks or more, we fall into a rhythm with people who are living in that area. So bring yourself. You don't need to have an appointment. You don't need to have an insurance card. We'll ask you your name. We'll ask if you have any contact information. We'll register you, but you can receive services without having a particular time slot reserved. You don't have to have an insurance card. We don't bill insurance. So really, we're doing everything we can to make it as low barrier as possible. And as I mentioned before, if you don't want to come to us at the van, but you're interested in the services, that's why we have the roving team, which will go pretty much in a half-mile radius around any one of our units to be able to bring services to people where they're set up for that day.
So this is really exciting. As a society, we're talking more about inclusivity. So I wanted to touch on the fact that your mobile units have some accessibility features. Can you explain what people in this community can expect?
Yeah, so all of our mobile units, so the vehicles themselves, are equipped with a lift. And so if somebody uses a wheelchair or they need something else to promote their mobility, we're able to get them up onto the main platform of the show unit if there's a specific service that actually needs to be delivered on the vehicle itself. Many times the services that we're seeking to provide, COVID testing, vaccinations of any kind, can be delivered in the private setup that we have just adjacent to the vehicle, so making it a lot easier for people to engage with us. And then of course we have our roving teams, which literally will come to where you are to deliver these services. think another thing that we're really proud of that extends our reach even further and allows us to get into every borough and really appreciate that local neighborhood is our video interpretation services. So we're able to provide interpretation in 25 languages, including American Sign Language. So if somebody is experiencing hearing impairment and they use ASL, we'll be able to accommodate them.
So, can you just tell us how can viewers stay in touch and stay up to date with your organization?
So the best way to keep in touch with us and stay up to date with what's happening with the Street Health Outreach and Wellness Unit is at our website. The link you'll find below. There you'll be able to find up-to-date lists of all the services we're providing, as well as the locations that we're going to be in for that period of time, our hours, as well as how to collaborate with us. So there's a form on there if you're a community-based organization and want to partner with us. We look forward to hearing from you.
All right, doctor, thank you so much for joining us.
Thank you, Kibin, and thanks everyone for watching.
We'll be right back with more Open BXRX Tuesday.